Florida just announced $60 million to explore generics like Ivermectin to fight cancer. Right now, generics don't promise big profits, so their uses may go unstudied and overlooked. Ivermectin, long used safely in people for parasites, was thrust into the spotlight when many doctors said it worked against COVID. The FDA began a campaign to call it dangerous. Houston Dr. Tally Bowden beat the FDA in court and is now part of a growing push to make Ivermectin available without a prescription. In 2021, the FDA was heavily promoting the upcoming COVID vaccine and discouraging prevention or treatment with medicine like Ivermectin. Despite Ivermectin's decades-long safety record and 2015 Nobel Prize for combating parasitic diseases, the FDA launched a public campaign against it. That included the FDA's infamous "You are not a horse, you are not a cow" tweet. And the FDA was falsely implying this is horse medicine that you people are taking, which is not true.
Exactly. They branded it as horse medicine. It was a hit job on Ivermectin. So we sued them, myself and two other doctors. All three of us just got pummeled for our stance on Ivermectin professionally with the boards and the public. And we actually won. The FDA backed down, and they had to remove their misinformation from the website, and they had to remove the tweet. But
years later,
it's still, I'm still having a hard time getting my patients. I can't, if I send a prescription to Walgreens for Ivermectin, there's probably a 75% chance they're not going to fill it. And that's 4 years later.
What have we learned about Ivermectin in this time period?
So there are now 105 studies supporting the efficacy of Ivermectin for COVID. No drug is 100% effective, and what I would do is combine it with other medications depending on risk factors and severity of disease. But all in all, it shows that basically the earlier you start using it, the more efficacious. But even when used late in the game, even the second week of the illness in COVID is when people really got sick, and that was this massive inflammatory response, less so from the actual virus, it was the inflammatory response. But even in those late stages, it worked, it helped. Anywhere from 30 to 40% decrease in intubation and mortality. And it's so safe.
Are there studies that look at it for preventive?
Yes, so that's actually, if you go to this, the meta-analysis of the data, the earlier you use it, even for prevention is actually the best outcome. But what we're seeing now, COVID is not life-threatening. I don't worry about my patients like I did used to worry about my patients. I don't worry about anybody now that gets COVID. And yeah, I don't discourage people from taking Ivermectin, but I'm not like, yeah, you need to take it for prevention at this point.
What is the status of over-the-counter efforts in states? And are you involved in some sort of effort to try to lobby the states to do this in the absence of action from the federal government?
17 states filed bills this last session to make it over-the-counter, and 4 have been successful. So Tennessee was the first in 2022. Most recently was Louisiana, but Idaho and Arkansas are also in there. Problem is, what I'm hearing from people, at least on X, is that even though they are legally allowed to sell it over the counter, you've got to find a willing pharmacist, and that's problematic sometimes. I encourage other doctors, maybe open up your mind up a little bit, do a little of your own research. And yes, you can do something about a virus early. And even Ivermectin can be used for other viruses. It has 20 mechanisms of action. It's anti-inflammatory, so even if you're not treating the virus, you can treat inflammation with it, and it's super safe.
In June, American frontline doctors filed a citizen petition to make Ivermectin and hydroxychloroquine over the counter federally, but there's been no answer.